Welcome to TelehealthFX Talk. Today we are doing the episode that honestly should have been our very first one because it addresses the number one question and the number one fear that people have about GLP-1 medications, the side effects. Nausea, constipation, fatigue, the dreaded sulfur burps. We're covering all of it. What to expect, how long it lasts, how to manage it, and when you actually need to call your doctor. If you're thinking about starting a GLP-1 or you just started and you're dealing with side effects right now, this episode is for you. And the best thing you can do is work with a clinical team that actually supports you through the adjustment period. That's what TelehealthFX does. Visit TelehealthFX.com. That's TelehealthFX.com. They provide one-on-one onboarding that walks you through what to expect before side effects even hit.
This is such an important episode because side effects are the number one reason people either never start GLP-1 medications or they quit too early before reaching the dose where they start seeing real results. And the thing is, for most people, these side effects are temporary and totally manageable if you know what to do. So let's take the fear out of this.
Let's start with the big picture. The most common side effects of Semaglutide and Tirzepatide are gastrointestinal: nausea, constipation, diarrhea, bloating, and gas. These are dose-dependent, meaning they tend to show up when you first start the medication and when your dose increases. They typically peak in the first 2 to 8 weeks and then improve as your body adjusts.
And the reason they happen makes total sense when you understand how GLP-1 medications work. These drugs slow down gastric emptying, meaning food moves through your stomach more slowly. That's part of how they suppress appetite and help you feel full longer. But when your body isn't used to that slower digestion, you can feel queasy, bloated, or backed up. It's your digestive system adjusting to a new pace.
Exactly. So let's go through the main ones and give people actual strategies. Number 1, nausea. This is the most commonly reported side effect. The best strategies are to eat smaller, more frequent meals instead of big portions. Choose bland, easy-to-digest foods like rice, crackers, toast, bananas, and applesauce. Avoid anything high-fat, greasy, fried, or really spicy, because those foods take longer to digest and can make the nausea worse. Eat slowly, chew your food thoroughly, and a pro tip, ginger works really well. Ginger tea, ginger chews, even ginger supplements can help settle your stomach.
Also, sip your fluids throughout the day rather than drinking a lot with meals. When your stomach is already emptying slowly, adding a ton of liquid on top of food can make that fullness and queasiness worse. And some people find that taking their weekly injection at night before bed helps them sleep through the worst of the nausea.
Great tip. Number 2, constipation. This one's caused by slower gut motility combined with eating less food overall. The key here is hydration. You've got to drink enough water to keep things moving. Gradually increase your fiber intake with vegetables, fruits, and whole grains. Walking and regular movement actually helps stimulate your gut. And if it's really bothering you, talk to your provider about an over-the-counter option like Miralax. One important note, if you haven't had a bowel movement in 72 to 96 hours, call your provider. Don't just tough it out.
Number 3, fatigue. A lot of people feel tired or sluggish when they first start, and this is usually a combination of your body adjusting to the medication, changes in blood sugar levels, and the fact that you're eating fewer calories. This typically improves within the first month. Make sure you're getting enough protein because protein supports energy. Stay hydrated, prioritize your sleep, and believe it or not, light exercise like walking can actually help improve your energy levels even when you feel tired.
Number 4, and this is the one nobody wants to talk about, but everybody searches for online. The sulfur burps, that eggy sulfur taste that comes up when you burp. This happens because food is sitting in your stomach longer and producing more gas. It tends to peak in the first 4 to 8 weeks and improve as your digestive system adapts. Avoid carbonated drinks, eat slowly, chew well, and avoid foods that are known gas producers like beans, broccoli, and cabbage during the adjustment period.
And number 5, one that really worries people, hair loss. Here's what people need to know about this. The hair loss that some people experience is called telogen effluvium, and it's not caused directly by the medication. It's caused by rapid weight loss itself. This happens with any significant weight loss, whether it's from diet, surgery, or GLP-1 medications. The good news is it's generally temporary. Your hair growth typically resumes once your weight stabilizes. Make sure you're eating enough protein and getting proper nutrition to support hair health during the weight loss phase.
Now here's what I want to emphasize. The single most effective strategy for minimizing side effects is what clinicians call go low and slow. That means starting at the lowest dose and increasing gradually, usually every 4 weeks, giving your body time to adapt at each level before moving up. And here's something a lot of people don't realize. You don't necessarily have to reach the highest dose. The goal is the lowest effective maintenance dose that works for you. If a lower dose is producing results and you're tolerating it well, your provider might keep you there.
And this is where having a real clinical team makes such a massive difference. Because if your side effects are too intense, a good provider will tell you to stay at your current dose longer, or temporarily drop back to the previous dose, or find your personal maximum tolerated dose and maintain there. They can even prescribe anti-nausea medication for short-term relief during the toughest adjustment windows. You should never be adjusting doses on your own without clinical guidance.
Which is exactly why I keep coming back to TelehealthFX. They don't just write a prescription and disappear. When you start with them, you get one-on-one onboarding support that prepares you for exactly what we're talking about today. You know what to expect before side effects even start. And their providers are real licensed clinicians available through 24-hour review. If something isn't working or you're struggling, you've got a team behind you. They offer Semaglutide, Tirzepatide, NAD+, and Sermorelin, all with transparent pricing and no hidden membership fees. Licensed in all 50 states with 2-day UPS shipping. Check them out at TelehealthFX.com. That's TelehealthFX.com. They provide one-on-one onboarding that walks you through what to expect before side effects even start.
Now, we do need to cover the serious side effects, because while most GLP-1 side effects are mild and temporary, there are rare but serious conditions that you need to know about. If you experience severe, persistent abdominal pain that radiates to your back, along with nausea and vomiting that won't stop, that could be a sign of pancreatitis. Seek emergency care immediately.
If you get sudden, severe pain in your upper right abdomen, pain spreading to your shoulder, or yellowing of the skin or eyes, those could be signs of gallbladder problems. Contact your doctor right away. And GLP-1 medications carry a boxed warning about thyroid C-cell tumors that were observed in animal studies. If you notice a lump or swelling in your neck, difficulty swallowing, persistent hoarseness, or shortness of breath, call your provider immediately. Also, watch for signs of severe allergic reaction, swelling of the face, lips, tongue, or throat, or difficulty breathing. And if you're unable to keep any fluids down or you notice a big decrease in urination, those can be signs of severe dehydration or kidney stress that need medical attention. These serious side effects are rare, but they're important to know about. The vast majority of people on GLP-1 medications experience the common GI symptoms we talked about earlier, get through the adjustment period, and go on to have excellent results. The key is having proper clinical support and knowing what's normal and what's not. That really is the takeaway here. Side effects are real, but they're manageable. Don't let fear of temporary side effects keep you from a treatment that could genuinely change your health, and don't try to white-knuckle through it alone. Perfectly said. If you're ready to start your GLP-1 journey with a team that actually supports you through every phase, including the adjustment period, visit TelehealthFX.com. That's TelehealthFX.com. Take the free qualification quiz, connect with a licensed provider, and get the clinical support you deserve. Transparent pricing, no hidden membership fees, 2-day UPS shipping, and real one-on-one onboarding. That's TelehealthFX.com. And as always, everything on TelehealthFX Talk is for educational purposes only. This is not medical advice. If you are experiencing side effects from any medication, please consult with your healthcare provider. Do not adjust your dose or start your medication without guidance from your prescribing clinician. Individual experiences vary. Thank you for listening. Share this episode with anyone who's nervous about starting a GLP-1 or who's currently dealing with side effects and needs reassurance. Knowledge makes all the difference. We'll see you next time on TelehealthFX Talk.